have my senior public relations officer, Mr. Emmanuel Aineviona, and my communication specialist, Abby Kananathan. Allow me to thank you for hosting us. It has been a little over 3 weeks that we have not updated the population, and we are eager to do so. But also allow me to greet my people from Lira City who may not have the luxury of seeing me from time to time, just to let them know that I value and care for them. I will now go straight to my statement. The Ministry of Health would like to update the public on the status of the COVID-19 pandemic and interventions that are being undertaken to ensure that the pandemic is kept under control. Allow me to start by giving the current trends of COVID-19 in the country. The country has registered 124,864 cumulative confirmed cases of COVID-19, a total of 96,321 recoveries, and 3,179 deaths. Currently, there are 239 patients admitted in health facilities countrywide. Furthermore, the positivity rate has dropped from 21%, which was the highest in this second wave, to an average of 3.4% in the past 10 days. The dominant variant that is circulating in the country is the Delta. The daily average number of confirmed cases over the last 1 month has declined and stabilized at 124 cases countrywide. That is the daily. From an average of 1,445 cases at the peak of the second wave in June 2021. Similarly, the daily average number of deaths has declined to 6 from 57 deaths at the height of the second wave. This means we still lose on average 6 people every day. While the country continues to register a consistent drop in the number of confirmed cases since the peak of the second wave in June 2021, we have not yet reached where we were at the beginning of the second wave, because at the beginning the curve was almost flat. Now we are not back to that level. Analysis of the COVID-19 data by our epidemiologists revealed the following. More females have been infected with COVID-19 in the second wave than males. In the first wave, it was more males than females. Hospitalization and death due to COVID-19 is predominant among those aged 50 years and above. And 61% of those who died in the COVID-19 treatment units had comorbidities such as hypertension, diabetes, and HIV. In the last 2 months, September and October 2021, 3 regions have been registering increasing numbers of confirmed cases and an increase in the number of affected districts in these regions. This points to a resurgence, and these districts are being followed up very closely as hotspot areas. The affected regions with pockets of intense transmission include Kampala City, Teso sub-region, and the affected districts are Soroti, Katakwi, Ngora, and Kalaki. Acholi sub-region, and the affected districts are Amuru, Gulu, and Nwoya. And then we have Lango sub-region. The affected district is Oyam. The main drivers of transmission in these districts have been identified as mass gatherings, for example, burials and weddings, weekly markets, the subsequent social activities and interactions, including drinking alcohol after market days, are acting as drivers of transmission. And we have widespread use of local remedies that have created a false sense of security and delayed seeking of care at the health facilities, and failure to follow standard operating procedures and congestion, especially in the city center. In response to the emerging resurgence in the above-mentioned districts, the Ministry of Health has intensified response activities such as deployment of surge teams, increase in amount of medical supplies and personal protective equipment, scaling up mobilization for vaccination of priority groups, and enforcement of standard operating procedures to ensure that the outbreak does not spill over to the neighboring regions. The National COVID-19 Response Strategy. The National Task Force continues to employ a multi-sector approach to control the pandemic. In this regard, the response strategy currently focuses on the following. 1, enhanced surveillance in all districts for early identification of hotspots areas and at the points of entry for prompt detection and control of imported variants. The Ministry of Health continuously carries out genomic sequencing on samples removed from travelers and selected samples from among the population. 2 is improved care for the confirmed cases. The Ministry of Health experienced high patient numbers, inadequate oxygen supply, insufficient bed capacity, and catastrophic expenditure in the private facilities with retention of dead bodies during the second wave. To address this, the ministry is fast-tracking installation of high-volume gaseous oxygen plants in Mulago and all regional referral hospitals, and liquid oxygen plants as a long-term plan. In the interim, adequate cylinders have been procured and will arrive in the country soon to be distributed to all COVID-19 treatment units. Bed capacity is being enhanced by preparing selected district hospitals in hard-to-reach areas and islands to handle COVID-19 patients, as well as train more health workers. In addition, we are strengthening home-based care through refresher training of village health teams and equipping them with home-based care toolkits, which include a pulse oximeter, a timer, a thermometer, disposable gloves, aprons, sanitizers, reusable fabric masks, torch, gumboots, bag, medicine box, job aids, registers, and referral forms. This is to ease their work and ensure that they refer the patients on time. I'll now move to the COVID-19 vaccination. The government of Uganda prioritizes COVID-19 vaccination as a strategic intervention for control of the pandemic and safe and sustainable reopening of the economy and the social sector, including schools. A total of 22 million people above 18 years of age are eligible for vaccination. However, 4.8 million vulnerable populations, including health workers, teachers, security personnel, the elderly 50 years and above, and those below 50 years with comorbidities, were prioritized for vaccination. Furthermore, 330,000 students in tertiary institutions aged 18 years and above have been included in the priority category to facilitate reopening of these institutions. Government has received offers for the supply of vaccines adequate to vaccinate 27 million people. 18 million people will receive vaccines procured by government, while 9 million people will receive donated vaccines. To date, government has received a total of 5,690,363 doses through donations and direct procurements, of which 2,378,171 doses have been utilized countrywide. I'll now give a synopsis of vaccines in the pipeline. Several vaccine molecules are in the pipeline, and between October and December 2021, the country will receive the following vaccines. 1. 700 doses of Sinovac vaccines from China. This will be coming in any time from now. 1,342,400 doses of AstraZeneca vaccine from Belgium and France. 300 doses of AstraZeneca vaccine from the European Union. 3 million doses of Pfizer vaccine from the US government. 1.2 million doses of Johnson & Johnson vaccine procured by government of Uganda through the African Union. 2,060,400 doses of the Sinopharm vaccine procured by government of Uganda from China. This gives a total of 5,342,400 doses to be received through donations and 3,260,400 doses through direct procurement by government. The pipeline vaccines expected are sufficient to vaccinate up to 13.5 million people. Therefore, the priority population of 4.8 million should be fully vaccinated by the end of December 2021. I'll now give a vaccine status update of the priority population groups. As of today, a total of 2,378,171 doses of COVID-19 vaccines have been administered to the population countrywide. The number of people who have received the first dose stands at 1,794,105, while 584,066 people have received the second dose. The vaccination coverage of the priority groups of people who have received 2 doses, that is full vaccination of COVID-19, stands as follows. Health workers, 34.2%, security personnel, 19.4%, teachers, 14.9%, the elderly, 50 years and above, 1.7%, people with comorbidities, 1.8%. These numbers are still too small. With increased availability of vaccines, I urge those eligible to get vaccinated. The ministry would like to reiterate that all vaccines being administered to the population at the designated vaccine sites are safe, effective, and free of charge. I'll now give an update on travel measures. As you may recall, Uganda has been testing incoming travelers with support from the private sector based on categorization of countries. The categorization took into consideration the presence of variants of concern, high rate of transmission of the disease, the number of deaths reported, and vaccination coverage of at least 60%. A request by the Ministry of Health for mandatory testing for all incoming travelers required an assessment of the capacity and premises of the private sector. High costs of testing, prolonged waiting time, and inconvenience by having to travel away from the airport were cited as major challenges that would affect mandatory testing by the private sector. A cabinet sitting of 13 September 2021 directed that government should carry out mandatory testing of all incoming travelers at their own cost at Entebbe International Airport and all other points of entry as a means of preventing importation of additional variants into the country. In preparation for this, the ministry, working with the UPDF Brigade, has concluded setup of the sample collection facilities, testing laboratories, and client flow processes at Entebbe International Airport. In the next 5 to 7 days, the walkways to protect travelers from rain, systems for online payment and furniture will be installed in readiness to begin the mandatory testing. In the interim, the status quo remains. The ministry will inform the general public on the date of actual commencement. Relaxation of restrictions on sectors under lockdown. On 22nd September 2021, His Excellency the President relaxed restrictions on some sectors that had remained under lockdown. The Ministry of Health has observed that since the easing of these restrictions, most sectors remain complacent to the standard operating procedures. This act of negligence may tip the country into a third wave. The ministry would like to reiterate as follows. A. Places of worship. The places of worship have been opened under the following conditions. There should be no more, and I stress no more than 200 worshippers at the place of worship. Physical distancing of 2 meters on either side must be followed with adequate aeration within the building. The 200 persons limit, physical distancing, and all other standard operating procedures should be respected, even during special occasions like weddings, funeral services, confirmations, etc. Ensure strict adherence to all standard operating procedures at all times. Hand washing, use of alcohol-based sanitizer, temperature monitoring, and consistent wearing of face masks by all congregants, including the choir and the preachers. Observe standard operating procedures during the Holy Communion. Worship leaders should wear gloves and place the bread in the hand of congregants. No congregation for worship after curfew hours, and worship leaders are encouraged to incorporate COVID-19 vaccination messages into their sermons and mobilize the congregants to get vaccinated. Weddings, burials, and other social events. The number of persons attending these events were increased to 200 under strict observance of standard operating procedures. And again, I stress this must be adhered to. Organizers of weddings are reminded to stick to this number and ensure that all guests maintain a physical distance of 2 meters in all directions, wear a face mask at all times, and hygiene equipment should be provided. Weekly markets. These were opened with strict adherence to standard operating procedures and the curfew hours, except for the hotspot districts of Soroti, Kampala, Kabale, Kumi, Tororo, Gulu, Nuoya, and Yumbe. The ministry has reviewed the hotspot districts, and Kalungu has been dropped from the list. However, Ruchiga and Rwanda should restrict the cattle markets. The RDC, RPCs, DPCs, DISO, and GISOs should enforce adherence to the standard operating procedures. I'll now talk a little bit about Ebola virus disease outbreak in the neighboring Democratic Republic of Congo. The Ministry of Health in the neighboring Democratic Republic of Congo has confirmed a new Ebola virus disease outbreak in Beni Health Zone of North Kivu. The case is a 3-year-old male who was admitted on the 6th of October 2021 with hemorrhagic symptoms whose sample tested positive for Ebola virus disease. The response teams in the Democratic Republic of Congo are currently tracking 100 contacts to this case. As part of our preparedness measures, surveillance has been intensified, focusing on all travelers from DRC arriving in Uganda through the various points of entry. Surveillance in border districts to DRC has been heightened. We appeal to members of the public to be vigilant and report any suspected case with Ebola virus disease symptoms to the nearest health facility. I would like to reiterate that Uganda has not reported any suspected or confirmed case of Ebola virus disease. In conclusion, as we scale up vaccination across the country in preparation for reopening of the economy and the social sector, including schools, I appeal to the general population to get vaccinated as soon as possible and continue to follow standard operating procedures. We need to protect each other from a potential COVID-19 third wave. I thank you all for God and my country.
Thank you so much, Honorable Minister, for your statement, which hasn't lasted so long. We'll ask for a few questions, and the Minister will respond. Like I said, we just need to close this in 1 hour, and the Minister spent just a few minutes to explain or to read to us her statement. I personally have 1 or 2 questions that will be directed to you, Honorable Minister, and maybe to Dr. Wayengera, and maybe the final one will be to Dr. Tegeny. I will start with Dr. Tegeny. What next after vaccination? That should be to you. So what do we do after we've achieved our target of maybe 4.8 or even vaccinating everybody? The other, Honorable Minister, is you just read to us here, and from what you're saying, the donations coming in are up to about 5 million. But I will specifically look at the 3 million doses that are coming in, the Pfizer vaccines that are coming in from the United States. We hear that the Pfizer vaccine demands or requires a booster dose to that. Now, these are coming in as donations. Are we also weighing in on the economic impact of the vaccine, especially these that we are getting as donations? What happens in the event that 3 million is here with us and vaccinated, and after a short while, we need a booster? What will happen to us to that particular one? The other question here is, I just want to know, we've seen or heard from you at the Ministry of Health, now cascading the vaccine centers to virtually everywhere. We see them in the taxi parks, which is a very good thing, running away from the conventional situation of going to the health centers. What has been the public response to these various vaccine centers? How is the public responding to that, and is it helping achieve that particular goal or strategy? To you, Dr. Wayengera, let's also know, when does immunity set in, especially when one has been vaccinated, whether partially or fully? Because these are questions that keep coming in. Somebody thinks when they go and vaccinate today in a taxi park or anywhere, then they have the immunity immediately. When does it set in? When somebody receives the doses, whether 1 or 2. Any question from the public before Nebion also reads to us that? Any question from the public? Anybody here? You're hidden. Ivan, Karibu, come nearer. And there was another hand here. I didn't see you. Please also come. Just stand here and just do it one after the other. Your media house, and make the questions either very brief or ask one.
Good afternoon. My name is Ivan Kaho. I work with UBC. I want to know how far with the developments of our own vaccine in this country. Then too, the issue of complacency. Let's take a case study of Kampala here. It's really pathetic when you go downtown. Is the minister as well cognizant of that? And plus public transport as well. They're ferrying quite a number of people compared to those that are required to be ferried. And then the issue of compelling people to take up the vaccine. Recently we have heard about health workers who are going to be asked, if you do not accept to be vaccinated, you will not get salary. And if you do not work, then you will not, we need clarification on that, Honorable Minister. Thank you so much.
Thank you, Evan Kahwa of UBC. Yes, welcome.
Yeah, thank you, Honorable Minister. My name is Mohamed Wamala. I work for Salt Media. To Dr. Misaj, how far have we gone with the study on vaccine mix and match. How far is that? And then when do we see the rollout of Johnson & Johnson vaccination?
Thank you, Wamala, for Salt TV. For the vaccine mixing and matching, Dr. Waingera will attempt to those. Then the Minister, of course.
Thank you so much.
Welcome.
My name is John Cliff Wamala. I work with NTV, Uganda. One is just an addition to what my colleague Ivan has asked. Honorable Minister, we saw when you were in Lira, you highlighted how healthy workers who are not vaccinated may not get their salaries. Do you plan on making this mandatory? Maybe from, because you said you start with the ministry, then roll it out to the national level. Because in a similar way, we have seen some government officials, like the RDC of Soroti, where he put out a note that whoever is not vaccinated will not access his office. Something the current laws, it is wrong and not within the law. So maybe I'd love to get it from you whether you plan on amending the law so that it's mandatory for all the citizens to be vaccinated, and if so, do we have the capacity anyway? Then two, you have highlighted that with this second wave, more females are contracting the virus as opposed to the males in the first wave. Maybe if you could help us with the numbers and maybe one or two reasons that you think have brought about this new development. Thank you so much.
Thank you, John Cliff. Thank you very much. Tom, I think now, gender balancing.
Yes, I am Zahara from NBS TV.
Unfortunately, the mic looks to be far from you. Can you just climb up a little or pull it down? Thank you.
My concern is on the 1.7% elderly vaccinated, and I think 1.8 with the comorbidities. Was it an issue of overestimation, or what could be the findings? Why this particular population? Why are their numbers not rising? Let's leave alone the issue of maybe their data is not entered into the system and all those things. Their figures have been static for quite a long time. Did we overestimate the over 3 million elderly to get vaccinated? And for the teachers, still at 19?
19.2.
19.
No, 14.
The number still remains quite low. Is it because of the delay to get the Sinovac for their second jab into the country, or did we also underestimate? Because most of them say they have been vaccinated.
Thank you. Thank you, Zahra. They've been vaccinated, by the numbers are still low. Finally, from you, the final lady here. Thank you.
My name is Esther Oluka. I work with the Daily Monitor newspaper. In the recent couple of months, there have been stories from members of the public complaining about the effects of some of the vaccines. I recently did a story on a lecturer. He passed away, and he complained that he got a second dose of the vaccine, but he began feeling unwell. But he's just one of several other people who have come out to complain about the effects of the vaccine. So, as the Ministry of Health, I wanted you to respond to that. There have been these complaints, and also a section of people have also lost lives because of the vaccine. So please help us address that. Thank you.
Thank you very much. Dr. Cliff, you have one other one?
Yes, sorry, thank you. Honorable Minister, I would love to find out about the cost of each dose of the Johnson & Johnson that we just received.
Okay. Thank you very much. Emmanuel, from the Ministry of Health.
Thank you very much. The only major question that is on social media is when are we going to deploy the Johnson & Johnson vaccine? People are eagerly waiting for it. Thank you.
Thank you very much. Maybe Dr. Waingera, to add on what I asked you, is there a situation that may warrant a booster dose for AZ and Johnson & Johnson, because we possibly looking at a Pfizer here, but we also want to know, because majority of our population have received the AZ, and about to receive the Johnson & Johnson, what situations warrant for booster doses? And I'll request that Dr. Waengera, you take it on first, answer the questions, leave the minister's questions, let Dr. Tegenyoso answer his, and the minister will do it finally. Welcome.
Thank you, Mr. Semakula. Good afternoon, viewers.
Could you push it a little higher, the microphone? That's okay.
Okay, I'll start with the questions that came from yourself. When does immunity set in after vaccination? First of all, it's important to clarify that one is not considered to be immune on one dose when we talk about full immunity. So in context of the one dose gives you just the partial immunity, and I'm talking in context of AstraZeneca vaccine, where you need 2 doses of the vaccine, and also Pfizer, those vaccines where you need to have a booster dose. So ideally, after receiving your second dose, immunity should set in 3 to 4 weeks after receiving your second dose, and that is full immunity. Anybody that has received just 1 dose can only consider themselves to be partially vaccinated or partially immune. How far is the process of our homegrown vaccines? Number one, I think the Minister of Science and Technology will come out to update on some of these issues. But the key thing is to tell you is that we are not yet, at least in clinical trials, and when that time comes to enter clinical trials, that information will be available to the public. The issue of compliance to the SOPs, the minister has talked about it in the statement. You remember, as a response, we also were working with an intersectorial committee, task force, and the idea was to enable monitoring of compliance to SOPs. But we have decentralized the response now to involve the leadership at the district levels. So we hope that there can be more monitoring of the compliance to the SOPs. Ideally, every lead of an institution should monitor compliance. This morning when I came in, I saw, I think, a poster at the UBC offices indicating you cannot get in without a mask. And ideally, that is what we expect. The same thing with washing hands, keeping distances. That should be done by the leadership of every institution. The issue of compelling people to get vaccines, I will leave that to the Honorable Minister. The study on match and mix, that study is just starting. We're still finalizing a few issues to do with the funding and the ethical challenges, but that study will certainly be undertaken. When do we expect the J&J? The schedule, again, is listed within the statement for the minister. The J&J should be here before the end of December, but the first date of reception should be towards the end of October. So we hope that we have already received some. The Honorable Minister has clarified that some J&J has already been received. The issue of why do we have low vaccine coverage, especially among the vulnerable? I think we need to appreciate that even though we've received 2.3 million doses, we are looking at a target of 4.8 million people to be vaccinated. So I think some of the things that have really contributed to this low percentage is the slow rate of access. This has just gotten accelerated in the last 2 to 3 months when we've had more vaccines being received. But also remember, vaccination is voluntary. We've not been pushing people hard to get vaccines. And I think that is something to be considered. I'll tell you that in some of the European cities, you cannot enter some public space if you are not vaccinated. And maybe those requirements might become mandatory as we go ahead moving forward. The effect, so why do we have small numbers? Why? Partly because, of course, the process has been slow, but maybe we also need to do more in terms of outreach, and clearly you can bear witness that over the last 1 or 2 months, we've really done a lot to make sure that we increase the outreach for vaccination. On the issue of the effects of vaccines, Madame Oluka asked, I want to assure you that the World Health Organization, working with the Ministry of Health and the UNEPI program, are monitoring the incidence of severe adverse events. The professor you are talking about who passed on, I don't know whether they passed on because of a severe adverse event to the vaccine. We clearly have the information around the cases that we've had that have been related to severe adverse events, and maybe the WR will briefly talk about that. So the cost of each dose, the minister will talk about that. And the last question is whether or not we shall require booster vaccinations in future. From what we see around in the influenza pandemics or outbreaks, particularly in the West, which are seasonal, people get vaccinated every other year. Whether or not that will become a requirement for us is something that we have to look at. It is possible that if we hurried, and this is the argument we are making from the global scale, if we hurried and vaccinated everybody globally, it is possible that we can potentially eradicate COVID before we begin facing the issue of variants that will require other vaccination or other boosters. So that is number one. But you know that has not happened. So it is important that we increase the coverage of vaccination amongst us. Number one is to make sure that, of course, we protect against the potential emergence of variants. But the second thing, of course, now that we are looking at is the, in terms of whether or not we will require another booster, is how long the pandemic will stay with us. So I will stop here and request the WR to come.
Thank you, Dr. Waingira. Thank you very much.
Okay, I will try to answer some of the questions, but not in the order they come. I'll start from where we have, where Dr. Misaki has stopped, which is monitoring of adverse effect. As he said, we put a lot of emphasis and a lot of effort to ensure that every adverse effect is investigated. And I could assure you, in Uganda, all the cases are looked with scientists around, from different aspects. WHO is involved, academics are involved, the Ministry of Health involved, and external partners are also involved. And I could assure you we haven't recorded any deaths as a consequences of the adverse effect of any of the vaccines. In relation to that also, the other issue which was raised is about mix and match. Currently, there is only one mix and match which is proven to be useful. The rest we don't have data to advise on, and that is AstraZeneca first dose followed by Pfizer second dose. The rest is all in at a level of a study, so we do not recommend that. And the first recommendation for all countries everywhere is that don't mix. But if you have to mix, then the only one which is safe is AstraZeneca followed by Pfizer. On vaccine development, I just wanted to say that the vaccine development for COVID, you don't only have to see COVID. That development would enable the country to have vaccine access to other diseases. And that is very important. Tomorrow, when there is another new diseases, Uganda should be in a better position to develop vaccines. The other issue which was raised is about booster doses. Currently, the global, what we call the scientific committee, the SAGE, just only this week has recommended a booster dose for almost all the vaccines, but very narrow criteria. And that criteria are people above the age of 60 and which could have compromised immunity because of cancer or other things. Otherwise, the recommendation is that we stick with the one dose in Johnson & Johnson and 2 doses for the other vaccines. So as Dr. Misaki says, that this is also a unique opportunity by vaccinating the vast majority of the world population. We might not need to think of a booster dose. But if we have to, it should be with a narrow criteria and usually 8 months after the second dose. Coming back to the first question is what after the vaccination? I think we have to look vaccination as one of the strong tools we have to fight COVID. But it remains that the other public health measures like sanitation, like keeping distances, in addition to having a good surveillance, not allowing the disease to spread, are things which we should do even when we have the vaccines at an optimal level of vaccination. So we should emphasized on strengthening our public health measures and our public and health services to tackle any potential disease, including managing this one. Thank you.
Thank you, Honorable Minister. We just have about 10 minutes to be out of here. And finally, one comes in here from social media saying, now that testing is done at the airport, should people test from elsewhere or travelers should just go to the airport? Because you find yourself having to pay twice, even with the result that is within the 72-hour frame. The Honorable Minister will just add that onto your questions. Welcome.
Let me start with that question. The mandatory testing at the airport by government is for inbound travelers. The outbound travelers are still encouraged to go and get tested at the various testing points that have been set up by the private sector. A few questions. The vaccine centers that are all over the place, how is the public responding? Very well. And we want to say a big thank you to the public. What we have realized is the youth are more agile and come much more quickly. The elderly are requesting that we follow them to where they are because of challenges of transport and accessibility. But they do want to get vaccinated. So in our new plan, we plan to have vaccination points in places where there are large congregations, places that are having increased rates of transmission, like the Teso sub-region. Will be going there shortly to carry out intense vaccination, the island areas, and so on and so forth. The issue of complacency was dealt with. We continue to talk about it, but it is your responsibility, me and you. Let me go straight to whether when there is no vaccination, no salary. It is important to note that many of the countries that have opened their economy are very strict about following certain procedures. And one of them is vaccination. They have gone to an extent of saying if you are not vaccinated, don't come into a restaurant. If you're not vaccinated, don't go to places of congregation. And that is encouraging their populations to get vaccinated. And so as an example, we are considering this within the Ministry of Health headquarters to encourage people there to get vaccinated. And we are saying very soon, we haven't started it, if you're not vaccinated, you may have to revise whether you come to work or not, because as the ministry that is, in the front line on responding to the COVID, we have to show an example. However, civil servants are permanent and pensionable staffs. No one will touch their salaries. But it is important to stay alive, and you have to question yourself whether we have to beg you to stay alive or you want to stay alive. The issues of numbers affected, female versus male, we have seen this a lot in this second wave, and mainly in the hotspot districts. And I will cite that again, majorly from Teso sub-region. You may be aware that burials are mostly attended by females. The majority of those who go to pray are females. And of course, they go along with the children. And some of this is causing what we see. But also in Teso sub-region, I am informed that the drinking of ajono is participatory, both male and female. And so that can explain to you why we are seeing more females, and actually children coming in. The issue of the priority groups, majorly the elderly and the teachers. Again, the challenge with the low numbers is not the overestimation, because these figures are UBOS figures. The challenge, as I hinted earlier, is accessibility. For us to be 100% sure, we needed to carry out a survey to find out if the majority are vaccinated. But you may only be asking those within Kampala area. Uganda is large, and there are many districts out there where we have not sent adequate vaccines, but also the vaccination points are few. The ones in Kampala have just been increased over the last few weeks, and that is why people can access from anywhere. And as I mentioned, we are concluding on the vaccination plan that will see us take vaccines closer to the people now that the vaccine molecules have increased. The cost of Johnson & Johnson is $5.5 US dollars per dose. And when are we going to deploy the Johnson & Johnson? My answer to you is that all vaccines are good. And the best vaccine is the one that you can access. So whichever vaccine is nearest to you, please get it. We shall be deploying different molecules in different areas based on the criteria that earlier on I highlighted. And that is epidemiological picture, the risk of infection, hard to reach areas, and so on and so forth. So don't sit waiting for Johnson & Johnson when you can access Pfizer, when you can access AstraZeneca. The majority of us here are vaccinated with AstraZeneca. So once again, the best vaccine is what you can access. Allow me now to thank the population for their good response. I continue to encourage you to go and get vaccinated so that we can open up the economy and the other social sectors that are still under lockdown, as well as get our children back to school. The responsibility to get vaccinated is yours and mine. Vaccination is voluntary, but vaccination saves lives, and we do want to see you alive. And lastly, once again, I greet my constituency and I say, Obango Kuduhu. Thank you very much.
Thank you very much, Honorable Minister. And well, I'm seeing people rising up. I think they'll find you in the corridors or out of here because the time here has actually elapsed and ended. I'm seeing those who still have some questions, but we'll just stop this here. And I think the others, you find a way of getting them from the Minister as we walk out of here. Thank you so much, Honorable Minister. My name is Jagger Samakola Ziksok, and thanking everybody who has been here for today. Until next time again, back to our normal and regular programming. Good afternoon.
The Stride Monument is situated between the Uganda Parliament Gardens and Kampala Serena Hotel. Built in commemoration of Uganda hosting the Commonwealth.